America is the sickest country in the world. This is a direct quote from RFK Jr., the head of the Department of Health and Human Services. While he's not correct, we are sicker than people in all the other rich countries and a number of poorer countries. In 2024, we spent $5.3 trillion, or 18% of our economy, and over $15,000 per person on health care. Still, many people lack access to health care here. Whatever we get for this huge outlay, it is not good health. Everyone's health in the United States suffers despite spending a massive amount on health care. Causes include our huge economic inequality and the lack of support for early life when a large part of adult health is programmed. Most people believe their own actions and health care matter most. The challenge is to get people to unlearn what doesn't serve them and relearn what matters. Easier said than done. It's easy to strike up a conversation about your workout routine or a new diet you've been trying. These can certainly improve your physical fitness, but when it comes to the core aspects of your overall health, it has more to do with where you live and the inequity in your environment. Inequity is rooted in politics and the political choices we make. Starting these important conversations requires us to find ways to be comfortable discussing uncomfortable topics. We must shine a light on what produces health in a society. But first, you must believe that Americans die younger than they should, and that the reason is not personal behaviors or the lack of the right medical care. In this series, we're going to provide some basic tips and strategies to help you play an effective part in improving America's health. In our first series, Unwell Nation, we went into detail of our poor health status and the major causes. Elected officials don't want to address our poor health as it won't please their donors. Those working in public health also avoid the topic. We are sicker than people elsewhere when we're supposed to be number one in everything. If you look at the data comparing our health to other countries, you won't find contradictions to our being sicker and dying younger. The vast economic inequality in the U.S. produces bad health outcomes by stressing us out. We're cutting social supports that help poorer people survive, but even the rich aren't that healthy. While medical care can treat illness and injury, the lack of medical care is not the cause of health problems. If we don't know what the problem is, there's no way we can address it and improve our health. Creating awareness of our poor health is the first big step to improving health in the United States. In this series, we'll detail various actions you can take to improve our health in the United States. If we do what is necessary to improve overall health in the country, everyone's health will improve. The impact will be felt more among those who are disadvantaged, young, or not yet born. As good as it feels to say we want to leave the world a better place for our children, it can be a challenge to work on causes that you may not benefit from. If you ask someone, do you want health or health care? Most are confused, struggling to find distinction between the two concepts. Explain the difference in simple terms. Medical care treats illness and injury, but the lack of medical care is not the cause of illness and injury. Americans are taught from an early age that the United States is the best country and leads the world in everything. Every school day begins by reciting the Pledge of Allegiance. In reality, we do not have liberty and justice for all. This is just one example of how to kick off these difficult conversations that need to happen in every community, including yours. Thank you for watching. Please like and subscribe. In the next video, we'll talk about ways you can play your part in improving America's health.